The introduction of auto insurance reforms in Ontario has undoubtedly started a lot of conversations with the public and stakeholders in a variety of industries. What these discussions did was help to underline just how complex the auto insurance system is in this province. Questions of consumer knowledge, accident victims' rights, and system monitoring have all been raised. We asked Dorianne Sauvé, co-chair of the coalition representing health professionals in automobile insurance reform, what she thinks overall of the changes to Ontario's auto insurance system.
I think that there was a lot of effort put into trying to find different mechanisms to look at cost containment, but also to look at what they consider to be consumer choice. Where the concern from the coalition has always been is the consumer really doesn't know the actual costs of receiving care until they are injured. So when you're purchasing your insurance, you're purchasing it with the idea you'll never need it. You're not purchasing it with the idea that this choice that I'm making will have a negative impact on what I'm entitled to. And most Canadians, and most Ontarians obviously, don't really know the actual costs of health care because in their mind it's always covered. So they never, until they have to get into the private system or the private insurance system, they don't really know the actual cost of care. And they don't know the impact of, caps and such like that, because in their mind, $2,000 sounds like a lot if you've never had to go out and purchase that kind of assessment. So I think our concern is where we have choices being made and how that's going to be monitored in terms of outcomes for claimants, injured claimants. Where you have a cap imposed, will that have a negative impact on accessing care? And we really won't know how that all plays out until after September 1st. We can predict where some of the pinch points might be, but we really don't know the overall impact until it rolls out. These are all reforms that have occurred with an absence of a real information in order to monitor some of the concerns within the system. So the insurers gather information about costs, but it's not gathered in a unified way in terms of how data is collected, etc. We hopefully will have a system through what is called the health claims for auto insurance system, which will mean that everybody submits their health claim, medical information, etc., electronically, and that will be put into a database, and there will be information available to all the stakeholders, the insurers, fiscal providers, to really know how the system is running. But we didn't have that up and running before we went into these reforms. So hopefully now we'll be able to monitor the impact of some of these choices.